The idea that strep throat or a scratched knee could be deadly is almost laughable, right? Well, not according to a frightening warning from the Director General of the World Health Organization. She says in the future, such ailments could actually kill. And that's all because humans are becoming resistant to antibiotics. Here to tell us more about this is CBC medical expert Dr. Karl Kabasele. How serious is antibiotic resistance?
Well, it can be very serious. I think what the Director General is saying is it sounds dramatic, but it's theoretically possible. If we continue to misuse antibiotics, and if bacteria continue to develop resistance to these antibiotics, it's possible that eventually we won't be able to control the bacteria the way we can so easily now with a few pills.
So at this point, how concerned should we be?
Well, I think we should take the threat seriously in that we've heard this many times, that when your doctor gives you an antibiotic, for example, you should take the whole thing. Whether you feel better or not, take it. If it's for 10 days, you take it for 10 days. The reason is that what happens is you start to kill off the weaker bacteria as you start to take the antibiotics. It can take the full 10 days or the full course of the antibiotic to kill off the stronger organisms. If you were to stop mid-course, you're letting these stronger organisms off the hook, and then they can come back, and because they're stronger, they can cause more serious infections.
But, I mean, how often are we misusing antibiotics, taking them when we don't need to?
Well, I think the answer is that we're getting better. At least here in Canada, we're getting better. But this is a global problem. So part of the issue here is the way that we control antibiotics. In some countries, you can go to a pharmacy and just buy antibiotics without a prescription. And so in essence, you're sort of making your own decision about whether or not to use them. And therefore, the inappropriate use becomes a problem in countries like that. So what we need to do is not only sort of watch our own behavior here in Canada and in the developed world, but to also help the developing world to manage this problem better.
And so are there replacements for antibiotics?
Well, what happens is when a particular antibiotic is no longer effective against a particular bacteria, what you have to do is then look around for other antibiotics that are stronger or sometimes have greater side effects or are sometimes more expensive. So it's, thankfully so far we haven't come across a situation where there's nothing that works. But the problem is that the things that do work may not be as cost effective or just frankly effective as the first line treatment should be if there weren't resistance.
But that's what the WHO's Director General is saying, is at some point we're going to get to the point where there's nothing that works, right?
That's the fear. And I guess the best case scenario is that when people hear a dire prediction like this, they're really going to take the message seriously and begin to behave appropriately when it comes to antibiotics.
So what can you do to alleviate the problem?
Well, I think, first of all, we need to have realistic expectations of when and when not to take antibiotics. So you may have a cold or the flu or what have you that's a viral illness. And yes, it may last for a long time. And yes, it may make you feel very miserable. But taking an antibiotic inappropriately isn't going to make you better faster. And what it can do is contribute to this problem. So take antibiotics when they're given to you and take them completely and exactly as prescribed, and don't take them for things that it's not appropriate for.
Yeah, I had laryngitis and I had an antibiotic prescription, but the doctor said 10% chance that they're going to work. So in a scenario like that, maybe we should just opt to not take the antibiotics.
That might be the best choice. The other thing is, now that you have those antibiotics, it's not a good idea to save them and then just sort of use them when you think it's appropriate.
No, I didn't fill out the prescription.
You didn't even fill it, and that's a good move. So if you have antibiotics hanging around the house, don't save them to use them later. Bring them to the pharmacy to have them disposed of, because when you need antibiotics, you'll be prescribed them. Take them completely once you've been prescribed antibiotics.
That's a good point. Thanks, Dr. Karl.
Thank you.
CBC medical expert, Dr. Karl Kabasele.